Global Session 6B. We talked about some of the initiatives of the Global Forum, and here's number 2, the Initiative on Child Care and Nutrition Research, that is helping to set research priorities in child care, development, and nutrition problems, especially those in the low and the middle income countries, with focus on research to inform policies for scaling up effective interventions. Third, it's the Global Network for Research in Mental and Neurological Health. That is, this network's objectives are to support key research and implementations of services needed for mental and neurological disorders in poor populations, to reduce the long-term cost of mental and neurological disabilities, and to foster the development and implementation of basic local infrastructures to carry out these tasks. And fourth, we have the Initiative for Cardiovascular Health Research in developing countries. This was born in 1999 as a joint program of the Global Forum for Health Research and the World Health Organization to promote and prioritize research, sensitive and context of specific research addressing the growing burden of cardiovascular diseases in developing countries. The partnership has since expanded to represent a range of international research agencies, public health institutes, and health of the global on a global level. And number 5 is the Initiative of Public-Private Partnerships for Health, aimed at increasing the effectiveness of public-private collaboration, particularly by helping those seeking to develop health products or to improve access to products needed to fight neglected diseases and other health problems in developing countries. And our last 6 is road traffic injuries. The goal of the initiative is to establish networking mechanisms and facilitate the establishment of partnership between road traffic injury research and institutions internationally that will support the development and strengthening of research agendas and research capacities in these low and these middle income countries. And sexual violence research initiatives aim to build an experienced and committed network of researchers, policymakers, activists, and donors to ensure that the many aspects of sexual violence are addressed from the perspectives of different disciplines and cultures. So the World Health role in the Global Foundation supports and in cases helps to implement the change. And they have one that's called RAIN. And this stands for Rape, Abuse, Incest, National, and Network. In other words, there's a mandatory reporting to protect children, the elderly, and others who require special protection. Most states require that, in certain cases, an observer contact authorities if he or she believes that the protected person is being abused. The requirements vary a lot by state, and in some, it's definitely a need. So we're going to look at next our nursing perspectives for the global situation, for the global trends.